I am Dr. Jennifer Prezioso with Balance Foot and Ankle, and today with me we have
Dr. Charles Hastings, the new guy.
Oh, the new guy, yes.
The new guy.
Today we're going to be reading some burning questions from the internet, questions that people have about their feet or their ankles. So let's get started.
All right.
Okay, first one coming up. Recently, I've been dealing with a lot of swelling at the bottom of my foot, and now it's starting to become quite painful. It's made a lot of my day-to-day activities more difficult, and I'm wondering if this could be metatarsalgia. So metatarsalgia is a common diagnosis that we use for generalized pain at the bottom of the ball of the foot. And yes, it can be very debilitating. It can make day-to-day activities uncomfortable, athletics, walking barefoot, things like that. The thing I think that we have to keep in mind with metatarsalgia is it's a very broad diagnosis, and there could be a lot going on that could be in addition to the metatarsalgia. We can have capsulitis, plantar plate injuries, stress fractures, what else?
And focal swelling versus diffuse swelling kind of confuses me there. But the word metatarsalgia, honestly, it's one of my favorite, most simply fixed things. Number two most common complaint in the office. We see every day, all day. It's nothing more than an athletic overuse syndrome. Up to 12 times your body weight, 15,000 cycles a day for 100 years with an ankle contracture that happens to everybody, and that fat pad melting away on the bottom of your foot predisposes everybody to this, oops, I did too much too fast. Now you have some pain under the forefoot. If you continue to load that painful area, you may actually create stress fractures in the metatarsals, and rarely, but sometimes I say like twice a year, you actually cyclically load enough to weaken the bone enough to actually fracture. But that's uncommon.
That's bad.
It's easily treated, but it's a very common athletic overuse syndrome that usually people just fix themselves.
And definitely something you want to see your foot and ankle specialist for.
Oh, yeah.
Because even though it seems like something common, there are a lot of things that we can do, treatment plans that we can offer
There
that
are
can
a lot
help.
of common misdiagnoses as well.
That's true.
No
yes.
aromas and whatnot.
Yes, yes.
Want to do the second one?
Yeah, you can read the second one.
All right.
Okay.
Question number two. I've had a hypermobility disorder for the majority of my life, but recently the bones in my foot keep breaking and seemingly with no trauma or real injury. I'm usually pretty careful since I know I'm at higher risk for injury, but I can't seem to figure out what's going on. Any tips on how to deal with this? So a hypermobile foot for her entire life and fractures. You want to start us off?
Sure. So hypermobility disorders aren't that uncommon. I think the one thing that stands out to me in this question is the bones breaking without trauma or real injury, and especially, is this a female? Yes, especially in female patients. I know that I really like to focus on bone health. Working people up for any signs and findings of osteoporosis, osteopenia, checking vitamin D, and doing a lab workup to really sort of assess bone health and get on top of that right away, because stress fractures and insufficiency fractures can also, in the foot, can also indicate that this is going on elsewhere in your body, and you can be at risk of other fractures and injuries.
Yeah, if hypermobility is the real problem, everybody sort of lives, they have to be a rigid lever and to propulse forward with each step and quickly become a hypermobile, shock-absorbing bag of bones kind of thing, they say. So everybody kind of goes back and forth with each step, but some people live on the more rigid side and they'll have more bone and joint issues because they have a harder time shock-absorbing. Then the people on the hypermobile side, this super gooey, flat-footed person, those tendons and ligaments have to work harder and longer and earlier to give you a stable platform because you're so hypermobile. So we see a lot of hypermobile feet, flat foot, tendonitis, sprains, those kind of things, and the more bony, rigid foot problems as well. Quite common. We have a lot of things at our disposal to help a patient kind of navigate and get back to life, their sport, their families.